Well, welcome to the Nursing and Nurse Practitioner Mini Career Chat. We have got Emily Hines with us, who is a nurse practitioner at Eford-McDowell Regional Medical Center, who's going to talk to us a little bit about her career field and how she got from being a center student into being a nurse practitioner. So, Emily, it's yours.
Okay, thank you. So like Joy said, my name is Emily and I am a nurse practitioner at Eford-McDowell Regional Medical Center. It's actually the hospital network in Danville, so I did not travel too far from center. But I'm a family nurse practitioner, so I work at a outpatient family practice office that is in town. So I see a variety of kids or a variety of patients from birth through death. So it's kind of cradle to grave is the spectrum of patients that I work with. And so while I was at center, I knew going into center that I wanted to do something in healthcare, but I wasn't exactly sure whether I wanted to pursue medicine or if I wanted to go into nursing. And so several summers while I was at center, I spent a lot of time shadowing in the medical field, as well as did several overseas service trips that dealt with healthcare. And so through all of that, I figured out that I wanted to pursue the nursing route. To me, it seemed like it was going to be the best opportunity for me to really engage with patients and build relationships with patients. But I also knew that I wanted to be able to function maybe a little more independently in healthcare than nursing. And so that's kind of when I found out about nurse practitioners. I was really unaware of kind of what they did prior to doing some research into healthcare. And so through some older center students that I had talked to, I found out about a program at Vanderbilt University that center had been pretty tied with in the past. And so it was a bridge program. And so they accept students with non-nursing bachelor's degrees and take them through their general nursing degree. And then you also receive your master's in nursing, which is one of the qualifications that you could have to become a nurse practitioner. And so after finding out about that program, it sounded kind of like the perfect fit. I loved center. And when I decided I wanted to go into nursing, I didn't want to leave it early. And so this seemed like a really good fit for me. And so that's kind of how I ended up kind of transitioning from center. I ended up attending Vanderbilt after I graduated center. It's a two full year program. And so I just graduated in August of 2019, so over a year ago. And so that's kind of how I ended up in the field.
Great. So what are the biggest pieces of advice that you would give to students who are wanting to go into this career field?
I would say that I think a lot of the conversations I've had with students and just younger center students that I knew was kind of the decision as to whether to go into medicine or go into nursing. And I think a lot of times people know what they want, and that's great. But for someone like me who wasn't exactly sure which direction I wanted to go in, for me, it came down to what I wanted kind of my day-to-day life in the professional realm to look like. And I knew that I loved interacting with people. I loved building relationships with patients. And so I knew that I wanted to do something that would give me the space to be able to do that. And so I think it's really important as someone or as a student who's trying to figure out what they want to do is to try to figure out what they think is going to make them the happiest in the day-to-day. And so for me, I knew that was going to be being in a realm that was going to allow me to build relationships with people. And I think that you can obviously do that in both medicine and in nursing, but I think nursing is maybe a little more tailored to that specifically. And so just kind of knowing what fits your personality best. And also just talking to people who are in both career fields. I knew a lot of older center students who were in med school, and I had several center friends who were in nursing school or nurse practitioner program. And so just speaking with them and kind of figuring out what sounded like it was going to fit me best was really important.
Okay, great. Are there certain types of experiences that you would recommend students get, one type over the other, either while they're in college or when they're first getting out of college and maybe not get into med school?
I would say I think it's really important to do some shadowing. I think whether it's going home during the summer and shadowing your family physician or shadowing a family friend who's in medicine or shadowing a family friend who's in healthcare in general, I think that's really important. I definitely would not have gotten a feel for nursing and a feel for what a physician's day-to-day look like or a nurse practitioner's day-to-day looks like if I hadn't done shadowing. And so I think that's really important, even if it's a week or so on Christmas break or over spring break. I think that that's a really important and easy thing to do. And I think if you don't have any family friends or don't know anyone you could do that with, Center has tons of alumni in all of those fields. And so I think that it would be a pretty easy thing to set up. And I also just think, even if it's not in healthcare specifically, I think doing just exploring different career fields, different community service opportunities. I was very involved in a lot of community service throughout my center experience. And I think that helped me realize that working with community and working with people of various socioeconomic statuses and walks of life was something that I really enjoyed through my time at center. And that was something that I wanted to translate into my future career in some capacity.
Okay, thank you. So thinking about your field, what would you say are the most rewarding aspects of the work that you do? And then on the flip side, what are some of the biggest challenges?
I think one of the most rewarding aspects, and the one thing I love about family practice, being a family practice nurse practitioner in particular, is that the relationships you get to develop with patients. I think my favorite thing is seeing a patient and just being able to sit and listen to their problems and listen to the concerns and then working with them to come up with a solution and then seeing them back in a couple weeks and seeing that solution work and how like rewarding that is, not only for myself but also for the patient to kind of have some relief or answer to their problems. And so I think every day and every patient is kind of like solving a puzzle. And so I think center students are uniquely even adapted to being kind of in this career field because no matter what your major is or no matter what class you're taking, we're trained to kind of think analytically and think critically. And so I think that training and kind of that process that we all went through in all of our courses at center has really helped me in this career field and just makes every day really rewarding. And I would say on the flip side, I think one of the most difficult things, I think being in any aspect of healthcare, but is just learning how to be present and be empathetic to your patients' problems and the things that they're going through without taking it home with you. I think that's one of the things that as a new nurse practitioner has been really something I've had to adjust to, is being empathetic and being compassionate without allowing it to ruin the rest of your day, for lack of a better words. And so you're kind of thrown into the midst of people's lives, whether that's good or bad. And you kind of have to learn how to separate yourself from that a little bit if you want to be able to stay mentally healthy and mentally present throughout the rest of the day.
Okay, this has all been super, super helpful information. Any final thoughts before we go?
I would just say, I think if you're interested in pursuing nursing or nurse practitioner specifically, I think there are so many center students who have kind of done that before you. And nursing is a hard thing to want to pursue at center because there's not a bachelor's of nursing at center. And so the path to kind of getting to that goal is definitely a little different than what most students at other colleges or universities have. And so I think if you know that that's what you want to do or have a very strong suspicion that's what you want to do, don't be afraid to kind of put in the hard work and ask questions because it's definitely doable. There was several students before me who had kind of gone through the same process. And since I've graduated, there's been at least 2 or 3 students in every class who's kind of gone through the same process I did. And so it's not the straightest path to getting your nursing degree or nurse practitioner degree, but it's definitely doable. And it's definitely worth it. I would not change one step that I took to get here. So.
Well, thank you. Thank you so much. This has been really helpful. I really appreciate you sharing this information and all this advice with center students.
Yeah, thank you.
Well, have a great rest of your day.
Thank you. You too.
Bye.